power from the battery. Just changing the battery and it works again. Wonderful. Um, but I must say I do like just a mobile with a big battery. Um, then you don't need to change the battery all the time and all that. But it's better than just having the mobile and just needing to fix it in a charger and all that. But I don't mind a mobile being a little heavier. Oh, it's itching down on the. Ooh. Oh. I hope it will. I hope it will work out. After some more days, that it begins to, because it's there. It's still there. The itch and all that. So it's not gone away yet. I'm still hoping that it will. That would be wonderful. It's supposed to be very, 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 very great. I still do wonder why the itch would be there. Why it is it something in regards to the fungi poison, or is it the threads, or what is it that makes the itch? Is it the damage in regards to the skin that done by the mycotoxins or the fungal poison? If you want to talk English, right? So yeah, yeah, itchy, 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 itchy. Yeah, it's itchy, 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 itchy. Burning in the groin and itching all the, just all these weird things. And then you go up to the doctor and say, and they're like, oh, you're just a nutcase. Yeah, that's great, great. Hey, great work, doctors, great work. Putting the guy in the nut box. Yeah, that's awesome. Yeah, so if you think I am a nutcase and all that, no problem, because the white coats thinks that's as well. They think I'm totally outrageous, apparently. But I'm not alone, apparently, because there's other people out there that actually have, some of the same issues that is put in the same box. So, anyway, so let's go. Ooh, it's itching. I guess the itch could be much worse, so, taking that into consideration, it's not. And I must say, of course, when I got the itch, it does, on the rest of my body, like on my legs and my arms and my face and all that, and the pressure in my face and the hotness and all that. I must, takes away from the thing in the groin, right? In regards of, it's like if you hit one foot, right? It's painful in the one foot if you hit it with a hammer. But if you didn't hit the other one with the hammer as well, now you have two one that hurts, and now you're not so focused on the one. Now you're focused on the other as well, right? So anyway, not that it's any better, but yeah. Um, so let's see here. That's also one of the things when you begin to have issues, bodily issues, and all that. You know, you pretty much just wish that you could fix your issues. You don't really care about money. You don't care about things in some sense. You pretty much care about getting yourself fixed. That's becomes that's yeah. Um, I could have understood. If you're an older guy and all that. We have a way of deteriorating in regards to this fallen world and all that. But yeah, but that's a stupidity, right? Going out and drinking and drinking and drinking, setting yourself up for sickness. Anyway, um, where did we go to? I'm feeling pretty. I'm feeling somewhat tired. Oh yeah, we have Candida balanitis. Balanitis presents as a penile whitish rash that is painful and also associated with this urea. Oh, it's a painful in regards of peeing and all that. I think that was probably. Um, Okay, this area, but I haven't really had anything in regards of having painful in regards of, and not really any wide thing in regards of the thing that they you know. So, but I had the itch, well, in the beginning, and I don't understand it, like why they didn't try Diflucan. It's a normal thing to try with women when they itch down there. Why not try it on the on? You have a penis, so let's not try that apparently. And let's try some psychotropic drugs because it must be up in your head, right? It's just um, I think it's totally incompetent. How could these doctors not know about? How could they not think? If they're using Diflucan for women issues down there and all that, why wouldn't they just try it out in regards to me? And of course, Diflucan doesn't just work down in the sexual organs; it works all over the body. It goes into the blood, it goes into the eyes, it goes into pretty much everywhere in the body. That's the whole point of Diflucan. So see, difficult or pain in urination. Well, I really didn't have anything of that nature, so can't say that. Because that would have been nice, I guess, in regards of maybe getting the doctors in the right direction. Um, and I guess that's one of the problems in regards of diagnosing fungus and all that, because there seems to be so many different things that people can get. So there's not like a norm in regards of it. There can be so many different weird things, and when you take it as a holistic picture instead of just, taking one, it's just a stupid thing in our society where you are part, what's it called, this word, you take one subject instead of actually looking at the holistic thing of it. you know um Dividing things up, and then, oh, he's good at this and that good at that and whatever. And instead, it's just, while it actually might need a holistic view where you look at all of it. The same thing in regards of the school system and all that. When I had the Danish on A, what is it called, you have Danish in different, and so you have it on A ladder, whatever. And when you were to write a report, you which I pretty much failed pretty much every single report, I think. But that doesn't matter. They just needed to be handed in. Just the last. I just needed to get over the last one in regards to the exam. So as long as I could actually get through the exam, it didn't matter if I actually failed all the rest. But the thing is, I had a way of going outside the box, and you're not allowed to go outside the box, even if the outside things are affecting the box. If the box is in the ocean and being flipped by the waves and all that, well, apparently you just need to look away from that. You only need to look into the box. Well, I'm actually being, I'm flying around in the box, dong, 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 right, up and down and all that. Hey, it doesn't matter, it doesn't matter what is outside the box. You just, look in what is in the box. You're only allowed to look. It's just stupid. It's maniac. It's just, but apparently you cannot be accepted in regards of if you're not keeping into the box. So I went up to my first exam thing and I failed that. And then I just went through I went in regards of the oral thing, I think it's called. I just got the grade that just made me through. And I was like, okay, so you have a second try for the exam. And I was like, okay, and I don't want to have Danish any time in the future in regards to this bullshit. I'm done with this. So I sadly compromised at the end, but yeah, keeping inside the box. It's just like, why would I keep inside the box when you have so many factors outside that is affecting the box? The things inside the box. Anyway. But that's the maniac thing in regards to this. This society. Just look into the box. In the box. Only in the box. Yep, anyway, patients with esophageal candidiasis also have oropharyngeal candidiasis. Women are at risk at developing vulvovaginal candidiasis, which usually presents with pain, vaginal discharge, dysuria, and painful intercourse. This is the most common form of candidiasis that can be identified in healthy subjects without known risk factors. And by the way, in regards to the Diflucan, if you have an issue down there and you cannot figure out what it is and so forward, well, first, of course, you stop drinking alcohol, and stop smoking if you're smoking, and get off all the sugary diet and all that, don't all that candy and all that, whatever, throw it away. Stop bread and such things, and go with the meat pretty much. Meat has no sugar in meat. Red meat is the best. And see if you can find a good source for that. Where the animals have had it pretty good and not being fed all the unnatural things and all. But you do just whatever. See what and not slaughter to Satan, of course, in regards of halal and all that. But anyway, you should be able to turn the boat pretty quickly. And but anyway, if you have the itch and they have, you can also try the Diflucan maybe. I saw this guy that said 8 days of Diflucan in regards to a man could actually fix the itch down there. And if you actually read the Diflucan thing, they talk about, hey, if, in regards to the penis and all that, fungal infection in the penis, it actually also, fix that. So, I have no idea why they never tried that with me. Think about 19 years of suffering and issues and, and who knows if I ever will get well again in regards of, so anyway, because I guess it's just up in my mind. I understand, I understand. The world thinks it's just my head that is, okay. Why would I ever make something like that up and go to the doctor, You have to be kidding me. Who as a man want to go to the doctor? That's the worst place to go to. Yeah. Anyway, you have to literally drag yourself to the doctor, to when there's no, with some, anyway, whatever. If I do wonder, maybe the doctors just thinks that I think it's fun running to them and dropping my pants so they can have a look at my weenie. I don't know. Maybe they think that, Maybe, yeah, because there's nothing as fun as going to the doctor and dropping your pants in front of... now, of course, you do it when you actually go to bath and all that. But yeah, it's actually interesting that you actually have female women actually also doing that. That I actually need to do it in front of females as well. Why would you actually have females in regards of fixing men? Why don't men actually fix men and women fix women, Why would that? It seems, anyway. So, this is a much most common form of candidiasis that can be identified in healthy subjects without known risk factors. If such women have intercourse with a male partner, the male partner might develop candida balanitis. So according to this, it seems like it actually can, be like a sexual transmitted, then it would actually be in regards of a sexual transmitted disease, right? If you're having sex with your partner and they have candida and you can get candida, well, that would be a sexual transmitted disease, An STD, I guess. I don't know. But I don't think they usually clarify it as that, But if you don't have it and you get it, well, that would be an STD, as they use the short form, I would think. Now, I was pretty much a virgin at that point when I got it, at least as far as I remember. I don't think I had, I had my black moments in regards to, because I was drinking way, way, way too much alcohol. But to get away from life, I guess, and from my other issue, and it's just, You start the ball and it rolls and it gets bigger and bigger and bigger and bigger and just, yeah. Oh well. And it could probably easily have been fixed in the beginning, you know. Again, these, you know, just, anyway, if such women have intercourse with a male partner, the male partner might develop Candida balanitis. Candida balanitis presents as a penile whitish rash that is painful and also associated with dysuria. Well, in regards of pain, yeah. In regards of itch, yeah. I didn't in regards of, you know, not in regards of not in regards of peeing. I haven't had any problem in regards of peeing. So that's no problem. But in regards of heatness, hotness, tenderness, and itchy. That was pretty much the itchy thing. Was the thing that really, that was the thing that started it all. You know, pretty much. That was, wow. That was bad. I was like, you know, it was driving you nuts. You know. Patients with neutropenia and malignancy are at risk of developing systemic candidiasis. Hepatosplenic candidiasis presents in these patients with fever. Yeah, that's one of the things I remember years back where I was, you know, trying to, you know, I felt like I had, you know, I felt like I was warmer than usual, and tried to get like, and it seems to be pretty good as I remember in regards of how hot it's, you know, in regards to you put it in the ear and you check yourself. I was looking to find evidence that I could, you know, show, and yeah, but anyway, I guess it gets kind of crazy with all these. Anyway, patients with neutropenia and malignancy are at risk of developing systemic candidiasis. Hepatosplenic candidiasis presents in these patients with fever, right upper abdominal pain, and jaundice that is non-responsive to wide-spectrum antibiotics. Again, antibiotics, think fungus poison, okay? Candidemia is another form of systemic candidiasis that is usually identified in hospitalized patients. Wow! They actually used hospital. They didn't use one of these big words, you know. Anyway, patients who develop, I guess they didn't use in regards of sickness, in regards of, what is it called? No, it's something with an N. Anyway, patients who develop a fever that is not responsive to antibiotics, you know, fungus poison. Patients have a history of prolonged intravenous catheterization and are usually in the intensive care unit. Disseminated candidiasis is another form of systemic candidiasis in which multiple organs are involved. Similar to candidemia, patients present with a fever that is unresponsive to antibiotics, you know, fungus poison, therapy, and are usually hospitalized and severely ill. Diagnostic workup for candidiasis similar to Diagnostic workup for candidiasis similar to different presentation according to the candidiasis syndrome. Workup is usually different from one patient to another. Patients with cutaneous candidiasis, I think that means in the skin, benefit from a wet mount or smear test that is obtained from the skin rash. Microscopic examination shows hypha and pseudohypha. Potassium hydroxide smears are also helpful for the demonstration of the pseudohypha. Cultures of the nail bed in onychomycosis can confirm the diagnosis of candida. It's like itching, although it's just incredible, you know. Cultures of the nail bed in the onychomycosis can confirm the diagnosis of candida infection. What is that? Nail bed? Cultures of the nail bed in onychomycosis. No idea what that is. Let's see what they mean. Oh well. And actually, you know, I look pretty. You know, I don't look. You know, there's no. You know, in the video, there's no there's no rash or anything. Like, I look pretty good. You know. As far as that goes. And that's the problem, I guess, you know, because the doctors haven't been able to figure out what is the issue, you know. They just look at me like, oh, doesn't seem to be anything wrong with you, you know? Huh. Yeah, anyway. You must be crazy. You must be making it all up. Well, maybe I have a fungus going wild in my body that you apparently has totally incompetent to figure out that, well, anyway. Um, so that was, let's see here. I don't know what the onychomycosis is, but anyway, can confirm the diagnosis of candida infection. So cultures of the nail bed in onychomycosis can confirm the diagnosis of candida infection. I have no idea because apparently the medical dictionary seems to fail me in regards to these things. Blood cultures are indicated in systemic candidiasis, but are usually positive in only 60% of the cases. So does that mean it only works 60%? So blood cultures are indicated in systemic candidiasis, but are usually positive in only 60% of the cases. Oh, so it's only... Okay, so if you have a systemic candidiasis, it's only 60% chance that it actually shows that it's actually, that's the way. A faster and more sensitive test has been developed to detect systemic candidiasis is testing blood for beta-glucan, a fungal cell wall antigen. But as I understand it, a lot of these tests you can't even, even if they test you, it's really good at hiding, so you might actually get results that shows that there's no problem, yet there is a problem. And it's just... Patients who presents the vulva vaginitis due to the thing, we have a huge amount in regards of the subject of bacteria and all that, and there seems to be a huge, hole in regards of fungus. I saw this doctor talking about, the thing in regards that we really don't know much in regards of fungi and all that. Well, something like that. So I think it was in regards to the Candida auris and all that, and there's like, we have a problem, the drugs or the remedies that we have at disposal, from the medical industry and all that, doesn't really work in regards of Candida auris. We have a problem. Yeah, well. Patients who present with vulva vaginitis due to candidiasis or balanitis benefit from a urine analysis, which reveals white blood cells, red blood cells, and yeast cells. Urine cultures might be indicated when in doubt. I actually went up to check in regards of a uranial thing and all that, and I think she actually tested the urine, and not growing any medium or something. I think she just gave me the results just after, so I guess must have just been something. I think that was just putting down the urine and just checking, and no problem, but as I understand it, you need to grow in regards of a medium to check if there's actually any. I don't know. Whatever. Let's see if if the Diflucan works. I hope it does. If the Diflucan works, if, and hopefully it will. Well, then of course the cause must be a fungus, right? And so anyway, I'll have to see. Yeah, I guess I have Diflucan for 2 weeks in regards to these doses, and then I can actually have a refill. So as I understand it, so I could actually go for a month on this doses, and so I can go for a good while in regards of the Diflucan, and see if it helps, So and then after that, that's the question. Then what then? And hopefully it will have worked. Hopefully it will have worked. Time will tell, I guess. Time will tell. I really don't know what to. There are other options and all that, but I really don't know what to do then if it doesn't work. It's there are options too, but overall, it's just yeah, I just, it's just, I know what I don't, I know that I know what I shouldn't eat, that's for sure. Bread and sugar, absolutely no go. I'm so stupid that I fell into that trap, or that I fell into, and it's not, I guess it's some month ago when I went to the bakery and all that. It's happened in this Roman year and all that. So it's not that long ago, I guess, compared to the overall expect that I got, that exploded up in my head and in my legs and, in my arms, and gave me this itch, all over my body, pretty much. Well, most of my body anyway, my legs, my hands, my arms, my head, and yeah. So, yeah, um, so patients who present with vulvar vaginitis due to candidiasis or balanitis. But again, if I just had caught it in the beginning, of course there would have been a lot less fungus, and thereby it would be easier to kill off. So, and the immune system wouldn't be 19 years ago. It would, I was younger, and it would have been, I wouldn't have been infected for so many years, so it should have kicked it back pretty easily if I just knew what to do, if I had just known what to do. You see some of these stories in regards to people having fungus issue and actually turning the boat pretty quickly just by doing some small things, removing alcohol or whatever, and I probably could have turned the boat by removing alcohol, stop eating sugar, and eating meat, primarily, and if maybe some Diflucan, maybe. I don't know if Diflucan would have been necessary, but maybe it would have been a good idea to just kick it back, or some natural antifungals for sure. Begin to patients who present with vulvar vaginitis due to candidiasis or balanitis benefit from a urine analysis which reveals white blood cells, red blood cells, and yeast cells. Urine culture might be indicated when in doubt. Patients with known risk factors for esophageal candidiasis need an upper endoscopy study. With a biopsy to confirm the diagnosis and initiate treatment. Patients with hepatosplenic candidiasis usually have cholestasis and an elevated alkaline phosphatase. Imaging studies plus upper endoscopy are indicated in patients with esophageal. I do wonder in regards to the endoscopy. Is that like in regards of the butthole? Butthole. That's still once. It's a good English word. Butthole. It's the butthole where the trash comes out. See, endoscopy. You have to be kidding me with this program. Do I really need to just use the other one to actually get something fixed? Yeah, it has. Okay, maybe the words are just too natural for it being in a in a doctor lexicon. Endoscopy, visual. That's the thing. If you actually had one program where you had the standard and the medical, you could as I had when I had the Nokia N8, that was just the way to go. Just search and you. Endoscopy, visual examination of the interior of the hollow body organ by use of an endoscope. Visual examination of the interior. Yeah, that doesn't sound good. Isn't that something like that? That doesn't sound good. You're not putting anything up in my butthole. Patients with known risk factors and would that actually help? Well, of course, that would be in regards to the infection of the insides, right? But if it's already viral in the body, I don't know. Anyway, whatever. Actually, maybe I should take the second dose of the nystatin as well. Let's just have it. See here. Yep. There we go. 500,000 units of nystatin, bought in Germany. Well, sent from Germany in some sense. You know, the rule goes that it's good to actually take with a meal, as I understand, after a meal. But anyway, so yeah, anyway, so you lessen the issues in regards of stomach issues if you have a meal before you take the nystatin. So, where did we go? Patients with known risk factors for esophageal candidiasis need an upper endoscopy study with a biopsy to confirm the diagnosis and initiate treatment. Patients with hepatosplenic candidiasis usually have cholestasis and an elevated alkaline phosphatase. Also, some says that one, before the symptoms actually goes down, that it actually, heightens the symptoms. So I'm really looking forward to when it actually begins to actually, break the ice in some sense. So still hoping, I might just be, it might not work. I'm still hoping, hoping to begin to see some, that would be so nice. Maybe stopping the itch, oh, that would be nice. That would be, or seeing the floaters die off. That's, maybe I was a little too optimistic, I think it's called, in regards of, I thought I would be able to see the floaters in my eyes maybe die off. That was the idea. I thought, that would be awesome if it actually worked. Yeah. But apparently it takes a little longer to work, apparently, because, I thought I would be able to maybe see them explode. That was a little too optimistic, sadly. So it would have been nice. Would have been a great show, sitting there, looking in the lamp and just watching them, what's it called? Apoptosize, I think it's called, in there, just explode, literally explode. I've seen some of these, videos where you see these things where they, explode, all their things comes out, all their, well, anyway. So that would have been a great show. Awesome show to watch, but yeah. Sadly, that doesn't seem to be the case. Again, it's going to take a little longer, apparently. And again, maybe it doesn't work. And if it doesn't work, I'm like... But again, all the symptoms that I have, seems to point that something is going on. So patients with hepatosplenic... Yeah, there we go with the nystatin in regards to the stomach, I haven't eaten, so yeah, there we go. Well, I don't have any food at the moment. I do have some coconut milk, but there's sugar in the coconut milk. I also found out there's actually different kinds of how much sugar that. Now, of course, it's very low sugar. We're talking very low sugar, but just a little sugar can actually, turn things on. I remember from the beginning of my meat diet and all that, and what was it? I forgot it. Oh yeah, so I bought different coconut things. I bought 3 different coconut, and I looked in regards to the sugar content, and there is a difference in regards to the sugar content. Now, of course, I know from past experience that there's different taste and all that. We're not talking about coconut water. We're talking about the coconut milk, which is... And some of the coconut milk that you actually buy can be very, very like creamy, and others are less creamy, And there's a difference in the taste as well. But apparently there's also a difference in regards of how much sugar there's in them. Now, in regards to the fat, I don't really, the fat probably have some of the good fat in regards of coconut that is antifungal. So I also tried to buy some because I wanted to make some coconut cookies, which I've heard, and I was like, oh, that sounds like a nice, way to get some coconut fat and all that in you and all that. I thought, but wow, there's a lot of sugar in that. I didn't look at it before. Actually, I think I have tried it in the past and I just forgotten about it, and then I bought these things and I came home with them and was like, oh my, there's a lot of sugar in that. So I put that on the shelf. The oil, of course, doesn't have any sugar, but I hate the oil. I just hate the oil. But coconut milk is pretty good if you get the right coconut milk. And it doesn't have that much sugar in it, and, well, at least less than the dried coconut. And it still have the oil, and it's actually pretty tasty, and you can actually... you can put things in the coconut oil, other antifungal things, it's just the imagination that is the limit in some sense, I guess. You might actually be able to put some, essential oils in it, antifungal essential oils. I don't know. Now, I haven't tried the different things, but that could be my, instead of drinking soda and all that, you could just be drinking these coconut milks with putting some essential oils that you like or that is antifungal and all that. You could try different versions. I don't know, but try different things out. That just sounds like a pretty good. And you could also put some what do you call spices in it as well. Just mix it up and I've done that, like for example, cayenne pepper, which is said to be a little antifungal as well. Have something in it, and just put it in there and mix it up with the coconut, and yeah. Anyway, so I think I could drink that, without any. I think I could enjoy that to every single meal or something like that. If and just put some antifungals in it and all that. Oh, I mean some itch in my butthole. Who knows? Maybe it's the fungus that wants out. Oh no, another nice statin coming. I want out. I don't know. Anyway, again, I do not know in regards of how, if you could overkill the fungi and all that, and I don't know if there's anything that could be bad by killing all these fungi and all that. Again, I'm going to try this. It's going to kill me anyway if I'm not going to do anything. It's just getting worse and worse. So I think it's worth a shot, man. I'll trying it out at the moment. So if it doesn't work, it doesn't work. But at least I tried it out then. But hopefully it works out, Now you hear about people taking Diflucan and it actually works for them, and then it comes again. So I guess that might be also if you're eating the wrong diet and you would still be feeding it and all that. And of course, if you haven't killed it totally off. So, so anyway, so trying the best, to get the best possible chance, having, anyway, just talking, I guess. Patients with known risk factors for esophageal candidiasis need an upper endoscopy study with the biopsy to confirm the diagnosis and initiate treatment. Patients with hepatosplenic candidiasis usually have cholestasis and an elevated alkaline phosphatase. And I still in regards of, in the past, I think, I remember when I was sick and all that, and, I was given this pill, or forced the pill into me. And I didn't want to have it. But anyway, I was had this pill forced into me at that point. I was sick and all that. And that was probably antibiotic, And then I remember in regards of the itch that at some point in my younger life, before, I think that must have been before the issues with my butthole as well, but I got the itch, I got the itch down there. And I do wonder if I had been gotten some antibiotics, if that actually destroyed some of the good guys and made the ball roll already at that point, and made, maybe already, I don't know, I really don't know. It's hard to say. I don't know what it was I was that I got. I had throat that hurt and ears and so forward. Most likely an antibiotic of some kind that they forced down into me. And I guess that might have been the thing that, and of course we're getting vaccines as well, right? Anyway, whatever the case, patients with hepatosplenic candidiasis usually have cholestasis and elevated alkaline phosphatase. Cholestasis and an elevated alkaline phosphatase. I don't know. But of course, I absolutely, in regards of over drinking and all that, absolutely did damage to myself, It's incredible how much I was drinking, That was absolutely stupid, And you can run away from your problems by drinking, but for a period, but you should figure out at some point that this is actually only making it worse. So it's a stupid solution to it will only get, just look at alcoholics that they have, they're digging their own grave by drinking. It's it's very sad. Alcohol is really bad, it's bad when you're drinking. Yeah, anyway. Like in Denmark, we have this culture of drinking so much alcohol, and this culture of going out and partying and drinking alcohol and so forward, stupid. It's really, really stupid. And now, of course, alcohol tastes like soda pops. Yeah, I guess Satan was really clever on that one, So now it's not even a problem in regards of tasting bad, in the beginning, Now it just tastes like soda pops. So you have the sugar, you have the alcohol, and it's just a perfect combination for fungi. Perfect combination for fungi. It's incredible. Anyway. So imagining studies plus upper endoscopy are indicated in patients with esophageal candidiasis. Ultrasonography can show ethygenic foci in the liver, intra-abdominal abscess formation, renal abscess, and renal fungus balls in patients with hepatosplenic candidiasis. Yeah, big words. Patients with disseminated candidiasis benefit from computerized tomographic scans to detect hepatosplenic abscesses. Renal abscess or pyelonephritis or echocardiographic is indicated to exclude candida endocarditis, in which large valvular vegetations can be identified. Again, I don't know, if you have a problem, why not, if you just, they could just, if they just use their time in regards of natural things, it's probably easy to treat, if you just, it's actually probably easy not to get these things, if you just don't do as most people are doing, right? Eating sugar, drinking alcohol, and all this, smoking and all that, where there's mycotoxins in it and all that. And all these other things that we have from our environment, and overloading it with poison pretty much, and of course antibiotics as well, and other so-called remedies that they use in regards of contraptions of not getting pregnant and so forward is said to also be a promoter of fungal issues and all that. Anyway, so treatment of candidiasis, patients with candidemia or disseminated candidiasis should be prescribed fluconazole, similar to the symptom-specific workup and presentation. Treatment is also tailored to the specific anatomic site involved in infection. So we have topical ketoconazole. What was ketoconazole? Was that the Nicerol? I don't remember. Anyway, we have ketoconazole, and that's one of the things. Also, I wonder if the Candida albicans becomes resistant to fluconazole, which attacks, all these azoles attack the same thing. So if the fungi becomes resistant or not susceptible, one of these big words, to the remedy anymore. What about the other azoles? Because if fluconazole doesn't work and it attacks the same thing as the other ones, wouldn't the other ones not then work? Or I don't know. I don't know. It just seems to if they're attacking the same thing, I don't know. But I haven't really seen it. Doesn't seem to be so. But I do wonder. I do wonder why wouldn't it actually, if it's resistant to one of these azoles, why wouldn't it be resistant to all of them? Because again, they're working on the same thing in regards of the candida, in regards of the I can't remember what it's called. Anyway, then we have nystatin, that is in regards to the gut. That's like the pill I took. Or we have the fluid form as well. It's like candy pretty much. I don't understand why people are, like, oh, it's disgusting. I don't understand that. I think it tastes pretty good. It tastes like licorice, I think it's called in English. Licorice with some peppermint, pretty much. Some peppermint, mint. Maybe it's called mint. The hot stuff and all that. Just a small amount of that. And I got the version without any sugar in it. So I don't know. Yeah, I don't know. Seems pretty good to me. Anyway, nystatin, clotrimazole, not sure what that was, or ecanazole can be used for localized cutaneous candidiasis, I guess in regards to the skin and all that. Patients with nail infection might need drainage of the abscess underneath the nail, in addition to oral antifungal treatment with fluconazole. In addition to oral antifungal treatment with fluconazole. There we go. And fluconazole is pretty much seems to be the first and foremost remedy against fungal infections in the body and so forward. Oral itraconazole, that's I would guess number 2, has been used successfully in patients with Candida onychomycosis. And itraconazole is also known as Spornox. But I must say, in regards of the symptoms, in regards of itraconazole compared to Diflucan, there's something in regards of itraconazole where I'm like, oh, that doesn't sound good. But again, I don't know if it's scare tactic or whatever. I don't know. In regards to the heart thing and all that. In regards to the liver thing, apparently it seems like people don't see any problems in regards to the liver and all that, yet they are telling that there might be a liver issue. I'm thinking, maybe it's in regards to the money, because, if the person needs to be checked and taking the blood and all that, and, going to the doctor and all that to get the results or whatever, that would be money, right? Giving some money. I don't know, maybe I'm totally, wrong, but, yeah. Again, Doc Kaufman talks about this, and they talk about patients and never seen it and never seen it and never seen it and this and that, and like, okay, so we haven't seen any elevated liver numbers and all that. So anyway, maybe it's in regards to really, 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 really sick people. I don't know. So oral itraconazole has been used successfully in patients with Candida onychomycosis. Patients with oropharyngeal candidiasis might be treated with topical nystatin or amphotericin B. In case there's no response, patients can be prescribed oral fluconazole or itraconazole. So that was in regards to the behind, wasn't it? In regards to the, I think it was up there. Topical nystatin, that would probably be the fluid thing, gobble it around in the mouth, and swallow it. That would have at least worked in regards of the local thing and all that. And of course, fluconazole or itraconazole works bodily, so that works, I'm not sure in regards of itraconazole in regards to the eyes, but I think it goes in the eyes as well, pretty much. But fluconazole seems to be in regards to the article that I read, seems to be the thing that is preferred to be used. So, patients with the HIV and oropharyngeal candidiasis should be prescribed a higher dose of fluconazole and should be initiated on the HRRT, amphotericin B or caspofungin. I was in regards to the caspofungin. Where was it I read about that? Oh yeah, that was the other application that I actually need to read before they closed me out. But they talked about caspofungin was also, either fluconazole or caspofungin, and I haven't really studied much into caspofungin, Erica. But it works a little different than the azoles. It works by attacking the what was it called, beta something. So anyway. I guess one have to be aware of that before actually eating things that might have these beta. I don't know. Anyway, caspofungin intravenously with diflucan is indicated to HIV patients with candidiasis who do not respond to oral fluconazole. So HIV patients with candidiasis who do not respond to oral fluconazole. Would not respond to oral fluconazole. Okay. So, or caspofungin intravenously. Oh, I didn't think you took caspofungin intravenously. I thought you took it orally as well. Or maybe you can do. I don't know. Anyway, with candidiasis who do not respond to oral fluconazole. So patients with esophagitis might have severe pain on swallowing, and initial IV, intravenous fluconazole can be used as first. Once the symptoms improve, patients should take fluconazole for an additional 2 or 3 weeks. Okay, so once the symptoms improve, patients should take fluconazole for an additional 2 to 3 weeks. That's a long time. But I guess it's to not have the symptoms come back. Well, I guess I'll have to, I don't know, I guess I'll have to look into, hopefully, after 2 weeks, I should be able to see if this works or not. Hopefully, Hopefully it's not so rooted that it needs longer, I would think after 2 weeks that I should see some things, and not continue in this state of, hoping. Once the symptoms improve, patients should take fluconazole for an additional 2 to 3 weeks. Women with vaginal candidiasis need a single dose of oral fluconazole, 150 milligrams, to achieve clinical and biological improvement. And again, sometimes they need to take more to get in regards of the issues in regards of the vagina and all that. So, as I understand it anyway, they need more than, yeah. Anyway, caspofungin, diflucan, or migafungin is indicated in patients with systemic candidiasis who are also neutropenic due to chemotherapy or hematologic malignancy. Patients with systemic candidiasis usually have a focus of infection such as an intravenous line which needs to be removed. have a focus of infection such an intravenous line, which needs to be, I guess in regards of the program that's, pops up here. I installed another dictionary, but so many dictionaries. I have no idea why I woke up in the middle of the night when I should also I need to fix the clothing at some point. What's it called? Yeah, wash the clothing at some point. It's running pretty low on the pants. It's pretty bad. I guess I don't have that much clothing anymore. It seems to go lower and lower and lower. Things tend to break, and these new machines that we have gotten and all that seems to actually also be destroying the clothing. It's just incredible. Anyway, so the old machine didn't seem to have a lot of where the holes, you get holes in it and all that. I do wonder if it's anything to do with these new machines, So patients with systemic candidiasis usually have a focus of infection, such an intravenous line which needs to be removed and all that. I guess you're breaking the barrier when you put something in the body and all that. And there was something in regards of talk about candidiasis also. There was one of them that could actually grow on the... Anyway, whatever. Patients with hepatosplenic candidiasis need more extensive treatment regimes that involved an induction phase with amphotericin B for 2 weeks, followed by 12 weeks of oral fluconazole. 12 weeks. Wow. So patients with hepatosplenic candidiasis needs more extensive treatment regimens that involve an induction phase with amphotericin B for 2 weeks, followed by 12 weeks of oral fluconazole. That's a long time. 12 weeks. Patients who develop intra-abdominal abscesses might need a surgical intervention to drain such abscesses in order for antifungal against fungal therapy to be effective. Patients who develop candida endocarditis always need a valvular replacement surgery. Bone debridement is indicated in patients with candida osteomyelitis, and I guess that might be an inflammation against in regards to the itis, I'm not sure. Patients with prosthetic joints who develop a candida infection of the prosthetic joint might need the prosthesis to be removed. Okay, I guess we're pretty much done with the candida here. Then we have in regards of coccidioidomycosis. It's interesting how long that people actually are on the Diflucan, because Doc Kaufman is talking about, it doesn't sound like, so long, in regards to the Diflucan, before you actually should be able to see. But anyway, we'll see. So yeah. Wow. Let's see here. Drug dictionary, fungi. The fungi thing was this weird fungi game. I don't really like it totally, but I don't know. Maybe one could. I don't know. It's a little. It's a little like. I don't know. It's anyway. So medical. We need the other one in regards to amboss. Oh, we also have the amboss Q bank. That was in regard. Oh, my memory doesn't seem to work that good. I was in regards of customs. It's actually also feeling pretty hot at the moment, as well. I guess that might. I don't know. Maybe it's a nice stats or something like that. Candida albicans. Let's make this one smaller. Candidiasis etiology. I guess, reading this and reading that and all that, I'm getting, I guess I'm getting that in regards of smoking cigarettes apparently is one of the issues in regards of risk factors. So again, stop smoking, so stop drinking, stop smoking, and stop eating all the sugary and, drinking and, yeah. What was it? Alcohol, stop smoking, stop alcohol, stop smoking, stop eating all the sugary stuff and all that. And if you do these three things, you might actually see a difference already there. Candida albicans appears almost universally in low numbers in healthy adults, but can cause disease in certain high-risk patients, especially those that are immunocompromised. Yeah, but it might actually also be a problem with people that are actually so-called competent. Summary. Here we go. Candida albicans is the most common cause of candidiasis. Okay. So, okay, okay, because I read the thing in regards of the ringworm fungus thing that they said was actually the most, fungal infection and all that. And I thought it was Candida albicans. I'm not entirely, as I understand it's still Candida albicans. That is the first and foremost, and then Aspergillus. But I might be wrong, but they talked about ringworm was pretty prevalent, and so again, I don't know, so much information, this and that, right? So Candida albicans is the most common cause of candidiasis and appear almost universally in low numbers in healthy skin. In the oropharyngeal cavity, that must be the thing out here, and in gastrointestinal and genitourinary tract. I guess that must be in regards. Maybe it's not. I would think it would be the urinary. Yeah, the genital and urinary organs of. Let's see.
Genitourinary.
Genitourinary. Yeah. Okay. So genitourinary tract. So we have the gastrointestinal tract and the genitourinary tract. But if it's actually already there, usually, well, the question is, well, even if they didn't find it and test it, it's just incredible. In immunocompetent individuals, Candida albicans usually cause minor localized infections. Including thrush. So again, the fungus can be a problem in immunocompetent individuals, in regards of thrush, in regards of, in regards of the groin area as well. And so, but anyway, it's just to show that you can actually get some issues. So maybe you can get some other issues as well. Anyway, even if you are immunocompetent, So anyway, Candida albicans usually causes minor localized infections, including thrush, affecting the oral cavity, vaginal yeast infections, if there's an underlying pH imbalance. And that would be nice to actually see what they believe is I think it was like 5.7, but I might be totally wrong in regards of the natural pH in the vagina. And then as I understand it, if the vagina goes up, then it goes bad, I think that was, anyway. I don't have a vagina, so I can't really check it, If I had a vagina, I would probably check it, I would pretty much. And I would, of course, know more about it. But I don't have a vagina, so I can't check it with a pH thing and all that. If that would be, whatever. And they have a whole bacteria, industry down there, the women. And I remember reading that, the women was like, I guess in regards to support, right? Because she's made as a helper for the man. But that, when you together with a woman, that the bacteria, would go from her to you. So you would get some positive things in regards of course, if she has a good environment, right? But, anyway. There's a lot in regards to the bacteria, in regards of babies being born and in regards of sucking and the milk and whatever and all that. So a lot of things going on in regards to these bacteria and things, these microbes. So Candida albicans usually causes minor localized infections, including thrush, affecting the oral cavity, vaginal yeast infections if there is an underlying pH imbalance, and infections of the intertriginous areas of skin, as to say the axilla or gluteal folds, folds of some different kinds, I guess. More widespread and systemic infections may occur in immunocompromised individuals, as to say neonates, diabetics, and HIV patients with esophageal. And of course, in regards of diabetes, in regards of diabetes 1, I think it's called, if that is actually, if they are destroying the beta cells, if they have gotten their beta cells destroyed because of fungus poison, they might also have some fungus in their system, Of course, they might have gotten the fungus poison outside, but again, there's a good chance that, with the fungus poison, you probably also could inhale spores and all that. Like, in regards of if you have mold, you're inhaling the spores and the mycotoxins, together. So, and of course, the mycotoxins will, suppress your immune system. And then there's, then the spores have a greater chance to survive, Anyway, fungus overall is just that way to, I think that is, if it's the way to battle, they cannot move, so they have another way to battle their opponents so they can survive, so they can make their babies survive, for the best of I'm tired. It's just totally turned upside down in my world in regards to these things. If there's an underlying pH balance and infection of the intertriginous areas of skin, as to say axilla or gluteal folds, I remember when I did these huge amount of vitamins and I got into this point and I sadly I didn't write down what I took and afterwards, when I blew it up in regards of drinking, some beer, just, went from up here, I just felt so good. I was sleeping like a rock. I woke up and was fresh. I was just awake when I woke up. I felt like, wow, I had energy and all that. I was like, wow. I took a huge amount of different kinds of vitamins at that point. I had like 2 or 3 days that was just, it was like wonderful. And then I just took 1 to 2 of this in regards of alcohol, and I was just back at, I was lured by a friend to I wanted to do some exercise, and he didn't want to do exercise. He wanted to play some pool and go to one of these bad places. I didn't really want to do it, but sadly I was not. Sadly I should just have went out running. I was like feeling so and I had so much energy. It was just so wonderful. Sleeping nicely like a rock and waking up. I was like didn't need any coffee or anything. I was just awake. I had just energy. It's like, wow, that was nice. I felt refreshed after the sleeping and all that. That was so nice. I think that's probably the normal thing if we haven't destroyed our. But sadly, it's many years ago. Sadly, I couldn't. I tried to take huge amount of vitamins and I just couldn't. And I didn't have money enough to just continue and to try things out and all that. And the things that I tried, I just didn't get into the same thing. But I thought, if I got into it once, I should be able to find it again, right? But I just, I don't know what combination I did to get that. I know I took huge amount of vitamin C. I was going to the equilibrium in some sense of the vitamin C. That was in at the beginning test scale of how much vitamin C you can take and all that. so sitting there and taking, I can't remember how many grams, but you're taking it to the dose where you begin to have the gut, speaking to you. And then if you go beyond that, well, you're going to the trip on the toilet, Anyway, so if there's an underlying pH imbalance and infection of the intratriginous areas of skin, as to say the axial or gluteal folds, more widespread and systemic functions may occur in immunocompromised individuals, as to say neonates, diabetes. I do wonder in regards to the vitamin C, by the way. Maybe that could. I need to check actually where the vitamin C is from. That's the source, because hopefully it's not from. I don't know. Hopefully it's not from corn. I have to check that. Anyway, I don't know if it actually. I guess it could actually have mycotoxins in it, in the vitamin C, if they're actually getting it from corn. Or whatever, some kind of, I have to check that. So more widespread and systemic infections may occur in immunocompromised individuals, as to say neonates, diabetics, and HIV patients, with the esophagus most commonly affected, Candida esophagitis. Localized cutaneous candidiasis infections may be treated with topical anti-agents, as to say clotrimazole. More widespread and systemic infections require systemic therapy with fluconazole or caspofungin. But what is caspofungin? A group of antifungal agents that inhibits the synthesis of beta-glucan. Actually, beta is actually vita. It's the Greek letter vita. It's not beta, but a lot of people say beta, right? It's the vita, alpha, vita, and what's it called? Alpha, vita. I can't remember the rest. Alpha, vita. Or would it be the B Ramma? I don't know if that's number 3. But anyway, so beta-glucan, but of course they say beta-glucan, a component of the fungal cell wall used to treat invasive aspergillosis and candida infections. But if you go to Greece, they're not, it's vita, it's not beta. But anyway, they have this idea of Greek language in the past, and apparently, so they don't just talk Greek, so, which is kind of weird, I think. But anyway, just making it more complex in some sense. So let's see here, a component of the fungal cell wall. So beta-glucan is a component of the cell wall and all that, and works on this instead of the, what was it called? We have, can't remember what it's called. Anyway, used to treat invasive aspergillosis and candida infections. Agents include caspofungin, megafungin, and anidulafungin. Generally well tolerated, but adverse effects include mild asymptomatic elevations of aminotransferases and alkaline phosphatase, gastrointestinal upset, and flushing due to histamine release. Okay. But it doesn't really say if it's actually oral as well. I do wonder if it's oral. Let's see if we can actually use this. Medical drug dictionary, whatever. Apparently it tends to load here. Okay, what happened? Did it just close it down? No, okay. Let's search. It's pretty slow apparently. Caspofungin. There we go. Brand name Cansidas worldwide is a lipopeptide antifungal. Oh, I can actually use this to actually if I could have made it some narrower, that would have been nice. So it's a peptide antifungal drug from Merck and Company, Incorporated, I think it stands for, discovered by James Balkovic, Regina Black, and Francis A. Beaufort. It is a member of a new class of antifungals termed the echinocandins. It works by inhibiting the enzyme 1,2,3 beta-glucan synthase and thereby disturbing the integrity of the fungal cell wall. Caspofungin was the first inhibitor of fungal 1,2,3 beta-glucan synthesis to be approved by the United States Food and Drug Administration. That would be the FDA. Caspofungin is administered intravenously. That's no go. Not so you put needles in the body and all that. That's no go. But so no oral thing apparently for that. Spectrum of fungal susceptibility and resistance for caspofungin has been effective in treating fungal infections caused by Aspergillus and Candida species. The following represent MIC, and MIC, that's in regards of the least the least amount you need to give, as I understand it, of the drug to have it working. Let's see if we can find the Stedman's medical here and go with the MIC. Abbreviation for minimal inhibitory concentration. The minimal concentration from that is inhibitory. Inhibitory. Oh, big words, right? Inhibitory, whatever. Restrictive of action, repressing, restrictive. I guess in regards of repressing, maybe need the other. Let's try inhibitory. It's probably not there, but inhibitory. Let's see. Inhibitory. No. Maybe I just copy pasted. Where is it? They changed the icon on the other application. It's just so annoying, This was the most wonderful icon, easy to see and all that. And then they just changed it to blue, It's just stupid, because of Google and their stupidity of rules. So they changed the icon from, that was the best icon that was on any application. Restraining, here we go with the medical definition. Restraining and tending to inhibit. Or inhibit. Let's try to inhibit. To curb or restrain. To curb. So what is curb? Oh, these words, No, we don't have that word, apparently, it seems. An edge, horse, the acting of restraining power action on limiting access. Well, as I understand it, it's the point where it begins to kill the, it's effective, where the drug is effective, as I understand it. Where did we have the... Itchy. Recent. MIC. Actually, I do have a package from bulk powders, I think they're called. And there's like selling big... that's also where I got the vitamin C. But I really have to... they have a chat function, so it's easy to actually write them. They usually write back and all that, so that's nice. So I really need to actually ask them in regards to the vitamin C where they are actually getting the vitamin C from. Because if they're getting the vitamin C from corn, then I'll have to ask them, do you test for mycotoxins? Because there might actually be mycotoxins then in it, I would think. There might, I don't know. Oh, they removed the 50% discount of the program. So that was a fast discount of 50%. Oh, well, whatever. It probably will come again after the 15 days or something like that. Like 50. Well, we'll have to see, whatever. I should probably also check if there's others out there, but anyway. It is nice to have a medical, book that you can look up in. I don't know what the medical. I actually have some questions in regards to that, of course. Maybe Doc, he knows in regards of what they would usually use as a lexicon. Oh well. So let's get back to. My brain is a little slow, it seems. There we go. Yeah, so that was in regards to the minimum something. Where were we? Minimum something. Where did we go from in regards to the minimum dose? I don't even know where we were. I just lost it. We have more widespread and systemic infections require systemic therapy with fluconazole or caspofungin. I'm not going to stick a needle in me. I do wonder where we were looking up the drug. Oh yeah, that was the reason. Oh, we looked up the drug, right? In regards to the other application, and then we looked for the minimum. Oh yeah, so we actually still have. Where is that? The other program in regards of it, drugs. That was the thing in regards of substip, and we get some ads. Sadly, the ad blocker doesn't block everything, but it blocks a lot, but not everything. Spectrum of fungal susceptibility and resistance. Caspofungin have been effective in treating fungal infection caused by Aspergillus and Candida species. The following represents MIC. That was the minimum something. I can't remember. Minimum what? Minimum recent. At some point I will remember it. Minimum inhibitory concentrations. Yes. Okay. The following represents the minimum inhibitory concentration. There we go. We'll take some more time to actually remember that. But anyway, susceptibility for a few medical significant organisms. I found out that the Danish, mycologist that is running this, on the state serum state thing, and also one of the big hospitals and all that. She's running an organization. I think she's the one that is director or whatever in regards to this. I'm not sure, but this organization in regards of finding the minimum things of. But I'm like, if there's a little more, I guess that wouldn't be a problem with it. I don't know. Why are we so, focused on? I guess maybe they can. I don't know. Maybe if they don't need if they don't. Yeah, I don't know. I just I guess in regards of not that they get the right dose and so forward, to in regards of effectiveness and so forward. But yet isn't it more like a if it's just working. I don't know but. If you just have more and it just works more effective, well then in regards to the minimum thing is just, who cares? I don't know. If again, I have to figure out how that works out, but if you take a higher dose of Diflucan and it actually works more effective than a lower dose, Even if you then are just taking more than the minimum thing and all of that, it wouldn't be a problem because it would just be more effective, right? I don't know. It's just I don't have all the data points. It's hard to figure, to get all the information. There's a lot of information that I haven't been able to find in regards of how does the Diflucan actually works. When the Diflucan, of course we, in regards of working, that's in descriptions about that. But the thing is, can it actually be reused? That's the thing. Can it be reused? Because as I understand it, goes through the urine, right? So is it actually in the body and just works again and again and again after doing, in regards of the Candida. Anyway, here we see in regards to the following represents MIC, the minimum in something, susceptibility for a few medical significant organisms. Candida albicans 0.015 to 16 micrograms per milliliter, and Candida krusea 0.03 to 8 micrograms milliliter. There's milli and all that. So we have milliliter and we have microgram. Cryptococcus neoformans, that's 16 micrograms and per milliliter and all that. I remember from the school thing and learning this kilo mega whatever and anyway and milli micro and all that. You tend to get confused in regards to these things. So that was in regards to the caspofungin. Pretty much, it seems like it's something that you actually inject. Now, I'm not too happy with needles. So, that's itchy. Oh well, itchy. I got the itch. Yeah, it's very sad. Let's go back. Bum 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 bum. Hey, when you think it does, when you think it can't get worse, hey, you have that's a surprise for you. And thinking, at least I don't have this problem or that problem. Hey, surprise! There you go. It's just, well. Where were we? It's only going to get worse, I guess. Well, of course, if it actually fixes this issue in regards to the Diflucan, that would be wonderful. That would be a great turnaround. That would be a great victory if that would work. That would be an awesome victory. Anyway, so still holding my hope up, Hope is a good thing to have, at least sometimes you just get into a move, where it's like, it's hopeless, sometimes. But yeah, it's good to have some hope that it might actually, be defeated at some point. But it might also just take me to the grave, Either way, guess time will tell. Pathogen, most common Candida albicans. Candida albicans. So we have more information on the Candida albicans in regards of candidiasis. Most common Candida albicans. Candida albicans, that's the most common, okay. Candida albicans is a type of oval budding yeast, see general mycology. Forms hypha and long pseudohypha, ubiquitous on healthy skin. That's a big word. Let's just push there. Being present everywhere. So apparently, so you could apparently find it. That was bad. Oh, that's a minus point for the program, Send feedback. Crashed. I don't know, just crashed. Oh no, maybe we should. Anyway, what else? That was bad. Candidiasis. Again, it ruins the flow. It's very annoying when things not doesn't work as it should, right? Um, bum, 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 bum. So we pretty much read that. That was the summary with the etiology. What is actually etiology? Etiology. That's a good etiology. Um, e. Oh yeah. The science and study of the causes of disease and their mode of operation refer to, I think it's called, refer to pathogenesis, the science of causes, causality, in common use, the cause itself. Atia, cause plus logos, treatise discourse. Okay, so anyway, the cause for things and all that. So we pretty much most common Candida albicans. Candida albicans is a type of oval budding yeasty general mycology. Forms hypha and long pseudo hypha, ubiquitous on healthy skin, as well as in the oropharyngeal cavity. So apparently they say it can apparently be found on the skin, and I think in there, apparently in normal and gastrointestinal tract. Again, let's see if we can actually find this word. Relating to or located near the oral yeah, and what is the oral cavity formed by the pharynx at the back of the mouth? Yeah, okay. But as I understand it, that's again so many, where you have conflicting information, and it's like, where some say it's only 50% that actually have it in the mouth or whatever, or, it's, can we actually live without this fungi? Is it normal in the gut in every people? Because it seems like some information doesn't say it's, I really have a lot of questions, so genitourinary tract and vagina. So risk factors. Immunosuppression is the main risk factor for infection. HIV, diabetes mellitus, and I guess that's just in regards to diabetes, as I understand it. I'm not sure why they call it mellitus. A group of metabolic diseases characterized by chronic hyperglycemia. The two most common forms are type 1 and type 2 diabetes mellitus. And I heard this guy say that, and of course I'm not no doctor and all that, but usually you use the insulin to fix the sugar into the cells, as I understand it. And, well, he said if you're eating meat, you will actually use more insulin than if you're actually eating sugar. That doesn't make sense to me at all. And of course, he couldn't he couldn't actually show evidence for any of that, So, there's so much bullshit out there. Why would you use more insulin if you are eating meat? If you're, the idea of insulin is to get the sugar in, right? And if I remember correctly, that was one of the sugars that don't need insulin to actually get into the cells. It was like fruit sugar or something. I can't remember. That was one of them that didn't need insulin, if I remember correctly. But then again, then you have the sugar that actually needs insulin to get in there, right? But if you're eating meat, well, you're not making any in regards of sugar or everything. You're just stable, I would think, because the body can make the sugar it needs from the meat, if it needs something. I guess it can break down proteins or whatever, But overall, it's, you would be you wouldn't be totally going up here in regards of sugar because you're not eating so much sugar. That makes more sense to me anyway. But what do I know? I don't know much. It's just so. But he was saying, oh, you're really using a lot of insulin when you're eating meat. Well, why would you use? You're using more. Why would you use more insulin when you're eating meat when there's no sugar in it? And the idea of the insulin is to get the sugar in. It just doesn't make sense. Anyway, I think it's bullshit. But anyway, what do I know? I might be wrong, but it just sounds like bullshit. So a group of, they really want to demonize red meat. It's in, I just read on one of these Candida diet sites, I think it's called Candida. There's one of these big ones, and there's some information here, and it's nice to have the information out there. It's nice to see that there's more information and more things in regards of Candida albicans. Whatever, I've learned from different people, different sites and so forward, and trying to, but anyway, one of these big sites that actually has some, good information in regards of antifungal and all that. They're also selling a book in regards to that diet and all that. You might get some good ideas and so forward, but anyway, then they talk about, you shouldn't eat too much red meat. I'm like, this is incredible. It's like, oh, red meat is just so bad. What are you talking about? Red meat is the best food source that I've been able to find. There's like this scaremongering thing in regards of red meat. That is, oh, you need to become a vegetarian and so forward. And I went for the vegetarian because I saw these documentaries. It was not because I didn't like meat, because I love meat. I'm a man. I love meat. Meat, wonderful, right? But I was lured into this. Of course, we want the animals to have a good life. We don't want the animals to have a bad life. So of course that would be, for example, I bought a lamb from Jylland in Denmark. That's where they have all the big places in regards of animals and all that. Anyway, and I bought they have pictures of that place in regards to where they're walking around, and you can talk to and I got a whole lamb, and it was wonderful. I got it like in a big box. I got a whole lamb, Well, I didn't get the head, and they're apparently not allowed to sell the head, and such things. Other places they eat the lamb head and all that, and but anyway, but it's illegal in Denmark and all that. This whatever. But anyway, and also I think with the feet as well is apparently not no go as well, I think, or something like that. But you could use it in regards of a soup. Apparently not. Anyway, but it's like a box, and they came out with it, and it wasn't actually, well, it wasn't that bad in regards of how much it actually was. And it was actually pretty good, meat, and yeah. Anyway, and it's not slaughtered to Satan. That's one of the things that I would, I don't want it to be slaughtered to Satan, to the, talking to the butcher and all that. So anyway, that was great. But I haven't really bought anyone after that, because again, it's still, I guess it would probably still be cheaper if I actually bought it instead of actually buying, I'm not sure. I have like 20 kroners for 250 grams of meat. I can't remember the price for the lamb meat, if you got a whole lamb and all that. Yeah, but anyway, I was pretty good. It's pretty good. Group of metabolic diseases characterized by chronic hypoglycemia. But again, lamb and cow, there's something good in regards of lamb and cow, in regards of meat, that that I don't perceive, that I didn't experience in regards of the birds or fish. There's just something in the meat that is positive on that was positive in regards of my groin area. Was actually very positive on the groin area. So that actually pretty much, went it from up here to here down here. I was really actually getting actually hungry. So a group of metabolic diseases characterized by chronic hypoglycemia. The two most common forms are type 1 and type 2 diabetes mellitus. I have no idea why they call it mellitus. What's mellitus? Can I actually... mellitus. 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 Oh my. Mellitus. I was just thinking about something. Oh my. Now anyway, mellitus, apparently it doesn't seem to be there. Anyway, so it's diabetes, right? So the two most common forms are type 1 and type 2 diabetes mellitus. Type 1 is the result of an autoimmune response that triggers the destruction of insulin-producing beta cells. So I guess that they are saying that the body are now attacking itself because of, yeah. Anyway, why would the body attack itself? Could it have anything to do with mycotoxins, maybe? Some fungus issues? Anyway, whatever. Response that trigger the destruction of insulin-producing beta cells in the pancreas and results in an absolute insulin deficiency. So you need to inject yourself and all that. And I get, when the damage is done, it's nice to have that you can actually, still continue to survive and all that, right? But it's cruel and the demonic to not tell the people why they're actually getting, diabetes in the first time, so they could actually, not, try to go around it. Yeah. It's good business. It's really good business if you can get the people on diet, these things. It's the Danish golden egg in regards of money. I was like, they had Carlsberg, Lego, and Maersk put together, and yet the medical thing that we have in Denmark was earning the double the amount of these three companies. That's a good amount. So, let's see here. Type 2, which is much more common, has a strong genetic component and a significant association with obesity and sedentary lifestyle. Well, it couldn't have anything to do with our overuse of antibiotics and our diet and, in regards of nutritious, destroying we're not, it's just, get so tired. No focus on good nutritious food, just sugar. It's like the same with the pagan festivals, How do you promote these pagan festivals to children? Oh, candy, right? Candy everywhere. Halloween, candy. Christmas, candy. Easter, candy. Sell it to the children, all these bullshit lies and anyway. Also something in regards to summary. So certain patient groups, as to say ECU, I'm not sure what that is. Transplant patients, surgical patients, and neonates. What's neonates? Newborn babies. The ECU. Why wouldn't they actually have anything to actually just check the ECU? Let's see. It's really stupid that it doesn't come up automatically. How hard can it actually be to fix? Intensive care unit. What is intensive care unit? It's like a baby. I'm not sure. See. Oh yeah, okay. In regards of critical ill patients and all that. Yeah, okay. Okay. I have the word of lung, like pulmonary ECU. Will be in regards of lung. Anyway. Transplant patients, surgical patients, and neonates. Imbalance in local flora, medications, antibiotics, steroids, cytostatic agents, immunosuppressive therapy, estrogen levels during pregnancy. That was in regards of actually causes for getting Candida albicans. So that we go in regards of so diabetes is one of the HIV. Medications like antibiotics, which is what? Yeah, well, it's It's fungus poison. It's from mold. The poison that mold produces, and you put it in a pill and you give it to the patient. Steroids, cytostatic agents, immunosuppressive therapy. Then we go in regards to the estrogen levels during pregnancy. Oh, that's true in pregnancy. Wasn't there something in regards of the monthly as well? I think it was. Now I'm not a woman, but I think it was after the period of the monthly thing, and yeah, well, I don't remember. But anyway, whatever. I'm not a woman, but anyway. Hematologic malignancies. But of course, in our days, we can just say, hey, I want to be a woman. And apparently, then you just, by a miracle, apparently, just become a woman. Which is just utter bullshit because, you still have the X and the Y, and the X and the Y is, in regards to man, just because you chop off your penis or whatever and all that, you're still a man, you still have the X and the Y. Hey, oh, well, Yeah, I guess maybe I could feel like a goat. Maybe I want to be a goat, a goat. I don't know. It's like it's just stupidity, And this is being promoted in the world, Oh, homosexual stuff and all that, and child. Yeah, it's just incredible. It's just disgusting. One thing is to do it, another thing is to go out and pride yourself about it. We should be ashamed of these things. It shouldn't be something that is promoted in society. Absolutely not. Anyway, we already know what happened to Sodom and Gomorrah, right? Yeah. So, anyway, hematologic malignancies, acute myeloid leukemia, multiple myeloma. Okay. Oh. Copper-white skin, excessive moisture, local lesions, as to say elderly with dentures, burns, and smoking cigarettes. Smoking may cause mucosal injury in hand-side Candida albicans virulence and or an imbalance in local flora. I was smoking. That was interesting. I was smoking, I was drinking, I was drinking a lot. Doing stupid. So no smoking, no drinking, and keep away from the sugary food. Yep, that's 3 good tips, I think. Actually, very good tips to, turn the boat around. Candida albicans appears almost universally in low numbers on healthy adults. So here it says, Candida albicans appears almost universally in low numbers on healthy adults. So it's only almost universally, so it's not all people that actually is okay, because it seems like we were reading where it actually says in the beginning here, maybe it was in the up here summary, that it actually says appears almost universally in low numbers. Okay. My bad. I missed that, So almost universally in low numbers on healthy individuals. But is it in its yeast form or in its viral form, or what do you call it? Not viral. It's fungus form. Has it begun to make these things out and all that? Is it? That would be interesting to know. Oh, tired. It's just incredible. Why wouldn't I be tired in the middle of the night? Why am I tired in the morning? It's just incredible. Why it's always in the morning that my system, my body responds that, hey, you're tired. But in the night, I wake up. I don't know. Why would that be? There must be something going on in the body in regards to that, It's like morning, that's now where I should be awake, right? And it's not that, it's just, I'm actually pretty tired. I want to go to bed, actually. Pathophysiology, Local infection imbalance in local flora, as to say, triggered by antibiotic. And same, anyway, antibiotic use. Okay, so local infection imbalance in local flora, as to say, triggered by antibiotic use. Local overgrowth of Candida albicans, local mucocutaneous infection, as to say, oropharyngeal infection, vaginitis. And vaginitis, what is that in regards to the vagina, in regards to vaginitis? I don't know. Let's have a look. Yeah, inflammation of the vagina. Okay. Oh yeah, it's in one of these ETs. Okay. Yeah, itis, inflammation, vagina, plus guess it stands for Greek itis. So vagina-itis. Yeah. Okay. Inflammation. As I understand it, it's not the inflammation that is actually bad. It's, did you just reset this program again? Oh, give me a break. You people. It's bad, candidiasis. That needs to go to the same place again. You have to be kidding me. Well, they need to work on that. That's absolutely no go. Of course, I only have 5 days, so anyway, to check it out and all that. But that's no go. That's bad. To restart and to need to find the place and all. That's bullshit. That's just bullshit. So where did we go for pathophysiology? I guess in regards of pathogen, in regards of something like that. Can I copy paste this? Copy. And it doesn't look it up automatically. Really bad. Oh. Pathophysiology. It's funny that it's finding it, not putting it on top, Pathophysiology, a derangement of functions seen in disease, alteration in functions as distinguished from structural defects, whatever. Local infection imbalance in local flora, as to say, triggered by antibiotics, fungus poison use. Local overgrowth of Candida albicans, local mucocutaneous infection, as to say, oropharyngeal infection in the mouth, and vaginitis, in regards of inflammation of the vagina, apparently. But in regards to the inflammation of the vagina, the inflammation is the things where the body reacts, as I understand it, right? So I guess the candida can then inflame it. That might be the cause of the inflammation. I don't know. Systemic infection, local mucocutaneous infection, breach of skin, mucosal barrier, or translocation. IV catheterization, ascending infection in pyelonephritis, or resorption via GIT. I don't know, GIT, loading knowledge. Gastro tract, okay. Okay, so that's a short form of gastrointestinal tract. So direct invasion of bloodstream, candidemia spread to visceral tissues. What is visceral tissues? Is that in regard? Let's see here. Let's see if we can find it. Oh, I need to search. Again, programs should make it easier, not harder for people. I just don't care for these things when we know we can make it easier. Relating to the viscaria. Yeah, what is the viscaria? Oh, so I need to copy paste that as well. You just have to be kidding me. You can't even push on it in this program. And it's 400 kronos. 400 kronos, and this is all that they get. Just give me a break. Plural of viscous. Oh, now we need to look at viscous as well. Yeah, give me a break. So I've looked that word up. So you go from one word to another word to another word. You have to be kidding me. It's like this nutcase world in regards of, yeah, you go to one place to another place and another place and another. Yeah, you're getting, where they're sending you around. Give me a break. Anyway. Viscous, visce, sera. Okay, let's see. An organ of the digestive, respiratory, orogenital, and endocrine systems, as well as the spleen, the heart, and the great vessels, hollowed and multi-layered walled organs studied in splenology. The soft parts, internal organs. Okay, so it's just the organs. Okay, yeah, okay, great. You could just have said that, right? So, okay, spread to visual tissues in regards of disseminated organ infections, as to say pyelonephritis or endocarditis. I have no idea what that. No, we can actually push on it. That's nice. An infection of the renal, pelvis, and parenchyma that is usually associated with an ascending bacterial infection of the bladder. Typical present with flank pain, costovertebral angle tenderness, fever, and features of cystitis, as to say dysuria frequency, and dysuria that was in regards of pain and the, and anyway. Endocarditis, I don't know what that is. It sounds like the heart or something like that. No, let's see. Yeah. A condition characterized by inflammation of the inner lining of the heart and valves, endocardium, generally caused by infection, as to say from microorganisms that spread hematogenously from a distant source. Other causes of from, I guess, in regards to the blood. Other causes include rheumatic diseases and non-bacterial thrombotic endocarditis, yeah, whatever. Lots of big words, lots of foreign words. Can we find it? Well, I think this program absolutely need. I guess that must be hematogenesis. I guess it must be the first one in regards of. That's blood production or something like that. No, I don't know. The process of formation and development of the various types of blood cells and other formed elements. I don't know. Anyway, direct invasion of bloodstream candidemia, spread to visual tissues, disseminated organ infection, as to say pyelonephritis, and endocarditis. There's apparently some references for different things. Yeah, okay. Yeah, different references. Clinical features. And you can put your note apparently also in the program and all that. Local, this clinical features. Local mucocutaneous. Okay. Local, is that in regards to the mouth or what? Oh. Oh, well, getting close to the battery running down, so it could actually close in any minute. Relating to mucous, membrane, and skin, denoting the line of junction of the two of the nasal, oral, vaginal, and anal orifices. That's the butthole, isn't it? Well, it can't call it the butthole, apparently. The butthole.